experiences as people who have tested positive and having had to go into isolation, and also unfortunately announcing there that a 56-year-old patient passed away last week. Let's now go back to Ekhazini district in Mpumalanga. President Cyril Ramaphosa is visiting that province to inspect COVID-19 readiness. He is accompanied by Health Minister Dr. Zweli Mkhize and Minister in the Presidency, Minister Jackson Mkhize, and also by the Basic Education Minister Angie Mkhize, but they have already been officially welcomed by the Premier Refilwe Mtsweni-Tsipane. Let's go there live.
Globally and locally has changed since the report by the World Health Organization that COVID-19 should be regarded as a pandemic. COVID-19 has not only affected the health of our people, but it has also contributed significantly to their livelihoods. Nationally, 168,061 cases have been confirmed since yesterday, in Mpumalanga, so far we have confirmed 1,478 cases and 7 deaths. This has also led to a negative impact on the economy, as we have seen linked to the lockdown. The country therefore responded by enacting the National Disaster Management Act. As it stands, we are at level 3 since June 2020. A number of socio-economic interventions have been introduced in the country. In terms of the health response, we embarked on a mass screening program, which included also testing and treatment and management of cases through our public and private health systems. As part of the response, a number of outbreak committees and establishments were announced, and we also started systems to ensure that the country has effective contact tracing mechanisms. In terms of the lockdown, it gave us an opportunity to prepare our health system, specifically in terms of our facilities, to be able to manage the upcoming surge in cases. At the community level, a number of infection and prevention control measures were introduced, which include social distancing, regular hand washing, and mandatory utilization of masks in the public spaces. Nationally, 1,706,127 tests have been conducted since yesterday. We now have 168,061 positive cases that have been reported since yesterday. 81,991 people have recovered, which is a positive sign. However, our deaths continue to increase. As of yesterday, 2,844 deaths were reported. And also the number of new cases or people who become infected continues to increase on a day by day. As of yesterday, 8,728 cases were reported. Mpumalanga has contributed to 1,478 cases, 7 deaths, and 520 recoveries. Nationally, there are provinces that are regarded as hotspots for COVID infections. These include Gauteng, Western Cape, Eastern Cape, and KZN. A province of concern is Gauteng, mainly because of the rate at which they report new infections, and also the slow rate at which cases are recovering. In Mpumalanga, just to confirm that 49 cases of all cases in the province were reported from Nkangala, with 729 cases as of today. A total of 1,478 cases were reported. 520 people have recovered. Nationally, 7 deaths have already been reported. However, locally, we have 2 additional deaths that are still being confirmed. So we believe that we have currently 9 deaths. And our contact tracing systems are very effective. And so far, we are able to trace and track and account for all contacts linked to our cases. It's important to note that about 4.3% of all cases are health workers, and 35% of all cases in the province have recovered. When we now zoom into our local municipalities, Emalahleni is a particular municipality of interest because up to date 426 cases were reported specifically from that specific municipality, followed by Governingbegi in Gertsibande and Steve Tshwete municipality in Nkangala again, and the city of Mbombela with 177 cases. So as a province, we have appreciated the contribution that these 4 municipalities are having on the overall case burden in the province. We, however, have noted that appreciating these numbers at the municipal level would not help us much in terms of our response. We have therefore moved on to say we want to look at where these cases are from at a ward level, so that we do not go into a municipality and do a series of interventions broadly, but we provide multiple combined targeted interventions in specific wards. What is also important to note in our province is that COVID-19 continues to affect the young people, with cases peaking for the age group between 30 and 39. However, we have noted that the age group between 20 and 49 is an age group of interest in terms of our intervention and reducing the cases in the province. Most of our cases are males, and they contribute to 53% of all cases. In terms of our response so far, as of the 2nd of July, the province had screened over 4.5 million people in the province. The majority of the screenings were from the community. However, a fair proportion were actually screened within the public health system. And we also have other screenings that happen through mobile services and also through digital apps. From our current cases, we have a total of 6,101 contacts, of which 2,346 are still actively being monitored, and 3,755 have been discharged and are regarded as not being infected. The province has so far conducted 43,459 tests, of which 7,988 were conducted in the public health system, and 35,473 are from the private sector. The outcomes of these tests is that 1,478 tests came back positive, 41,981 tests were negative, and we still have a backlog of 848 pending results. It's important to know that we used to have a higher number, which at some point was reduced to just below 250, and now we are seeing backlog, coming back. So it's a systems problem that we would need to look at. In terms of case management, so far 726 of the cases under isolation, the majority under self-isolation. We have 39 patients admitted in the general wards. 7 patients are in high care, 4 patients in ICU. For today, we report 9 deaths and 520 recoveries. Just to say that this stats is a combined report from both the public and the private health sector in the province. Unfortunately, we have started to see deaths in the province. What is very important is to note that the majority of the deaths are from young people. Only 2 deaths would be regarded as the targeted high-risk population, which we have seen globally and locally. So it's quite important for us as a province to look at how best do we reach our young people in efforts to prevent COVID infections and to screen them for some of the comorbid conditions. It is also important to know that diabetes and hypertension continue to be significant contributors to the COVID-related deaths in the province. In terms of health workers, it's very unfortunate. It is something that we would really want to avoid, but unfortunately our health workers are also exposed to COVID-19. The majority socially, outside the workplace, but they're also within the workplaces. The critical issue about health workers is casual interactions amongst ourselves, especially during lunch breaks, and so on. And we need to work on encouraging ourselves to always be cautious and put up appropriate PPE as needed. So far, 56 cases were reported, of which 36 are still active, 18 have recovered, and from the 56 cases, 514 contacts were linked to the primary cases. The majority have remained negative. However, we still have 23 pending results from health workers who are contacts of other health workers. We also have noted the increase in the number of educators and learners who are exposed and therefore become infected with COVID-19. So far, a total of 25 schools in the province have reported cases of COVID. We have confirmed 37 cases, of which 23 are educators, 9 are learners, and 6 include support staff within the education system. Now, we have appreciated as a province that in the last 2 months or so, we have worked hard to prepare the health systems, to become ready for the upcoming surge in cases. We have now devised a strategy which would then want to look at a community approach in terms of how we respond to COVID-19. The goals are as follows. The first goal is to contain and limit the spread of COVID-19, but also to address critical socio-economic and health system issues caused by the pandemic. The first objective would be for the province to establish a multi-stakeholder and systematic response against COVID-19, to anticipate and manage the health crisis, to ensure that vulnerable populations, their food security is secured, to support and protect vulnerable populations, and also to anticipate and mitigate the impact on the economy and health services in the province. The strategy is based on 5 priorities which have been looked at in terms of the pre-surge, the peak surge, and also the post-surge. We realize that we are about to hit the peak, but it's important for us as a province to start to prepare for the post-surge and the impact that COVID would have had on the social well-being, the mental well-being, and the economic impact of our society. The first priority is that the province will set up a provincial nerve center, which would include multiple stakeholders and will ensure that there is ongoing engagement and coordination. We will prepare an integrated operations to accelerate the response. We will adopt technology to ensure that we are able to track COVID epidemic at the ward level. We will have proactive mechanisms of communication and ensure that there is overall preparedness from the high levels in the province up to the ward level. The second priority is to anticipate and manage the health crisis with 3 priorities. The first priority would be to contain the epidemic and ensure that we interrupt the ongoing cycle of infection and launch a very strong behavioral change initiative in the province targeting specific population groups and specific wards where we see a rise in cases. We are already prepared for the surge capacity across the health system. We will, however, continue to monitor the situation and ensure that adequate infrastructure, medical supplies, and the workforce are made available as per the disease trends. And it's quite important for the province to also look at essential health services, be it antenatal care services, family planning, immunizations, and ensure that all these services are maintained during the pre-surge, surge, and post-surge. We want to ensure that we support our populations and secure food supply chains and essential services. We want to ensure that supplies of essential products are essential and ensure that prices are competitive to ensure that our population is able to consume and they are also protected. And we will ensure that there's effective monitoring systems across all levels. We are also supporting the essential services in respect to education, telecommunication, and utilities that are essential for our people. We want to ensure support for vulnerable populations. We want to protect jobs, retraining for crisis needs as needed. We want to ensure that the most vulnerable populations are protected, which include women, children, and persons with disabilities. We want to support small businesses and support and provide social safety net and mechanisms and distribution. As part of this, we also want to use the current model, the clinic ward-based model, to ensure that vulnerable populations who live with chronic diseases are actually screened, and we ensure that the majority of those patients are controlled. The last priority is to anticipate and manage the impact on the economy. So we have already done the analysis. I believe the Premier has announced the different sectors that would be supported. But importantly, we want to prepare for the recovery. We want to ensure that there are plans for a new and stabilized environment within our province. This is the operating model which we have started to implement, where we put our communities at the forefront. And we believe that the Department of Health would continue to provide critical leadership, as COVID-19 is mostly a health issue. However, we appreciate that to win the battle against COVID-19 would require other secondary functions to support the Department of Health. This would include all government departments, civil society, the private sector, community leaders, and every member of the population of Mpumalanga. We believe that critical enablers would be the availability of key resources to strengthen key processes around the engagements of the different departments, to ensure that every decision we take is driven by data and the insights that we get from that. The province has also taken a decision to adopt technology as a means to engage our communities, but also in terms of our response against COVID-19 and to improve effective communication across the different functions. The success of this model would be effective governance, and to ensure that all these plans and what we're executing, we are able to monitor and evaluate and take timely decisions as needed. Immediately, these top 5 interventions are what the province is now going to implement in preparing for the surge, but importantly in ensuring that we minimize the number of cases in the province, we minimize the social impact of COVID on our society, and we partner with our local communities to ensure that it's a shared collective responsibility between government and our people in terms of combating COVID-19. The first one is a behavioral behavioral change initiative, which I will discuss. We want to strengthen risk communication and community engagement at different levels. The province has adopted a ward-based containment approach. We want to ensure that all high transmission areas and hotspots are targeted with high impact responses, and we ensure that surveillance is strengthened and we monitor adherence to the current lockdown restrictions. So the province would launch a community-wide behavioral change campaign, Siyanqoba Sonke. This campaign would focus on creating awareness to ensure that different parts of the province, communities are aware of COVID and the collective responsibility to win the battle. We will share the benefits by ensuring that there's consistent messaging. There is one message, in the province, many people who are communicating the same message and many voices as needed. We will continue to engage political, religious and traditional leadership to lead communication and advocate for change, and also design communication messaging that emphasizes the benefits of adopting new behaviors. We will focus on personal, family and community level benefits. We will also communicate the intervention successes so that we continue to update our communities. We will also retrain and reskill our communities so that we are able to enable them to adopt the new behaviors, and mostly using demonstrations at that level, and also to ensure that those who adopt the new behaviors are actually supported through monitoring and support as needed. We've also looked at the importance of reviewing and improving our risk communication and community engagement readiness and response to COVID-19 disease. The key goals would be to coordinate and encourage collaboration amongst response partners at different levels up to community level. We want to establish and build and maintain trust with our communities. We want to encourage people to adopt protective behaviors. We want to ensure that we timely communicate and manage expectations, and ensure that if there's any uncertainties, we are first to communicate about such. We want to provide information and guidance as needed. The key focus areas would be to ensure that we have risk communication systems, that both internal and external partner coordination is done through a coordinated mechanism. We want to ensure that there is public communication where we would engage all influencers and leaders, specifically at ward level, to ensure that they have adequate information so that we have one message across the
just experiencing audio problems there, but a presentation to President Cyril Ramaphosa by Dr. Lesego Mawela, who is part of the Provincial Advisory Committee in the province of Mpumalanga, will continue to make attempts to reconnect, as that's an important update there in terms of how ready the province of Mpumalanga is in its COVID-19 responses. Let's take a break for now.